Hello, I'm going to talk about Estriol Vaginal Cream today. Estriol Vaginal Cream is the most popular prescription we compound and dispense at Moses Lake Professional Pharmacy. And if you have been prescribed Estriol Vaginal Cream, there's a few reasons why. First of all, I believe every postmenopausal woman should be prescribed some kind of estrogen cream. I prefer Estriol Vaginal Cream. It is more specific to vaginal tissue than some of the commercially available products, mostly talking about estradiol and talking about Premarin Vaginal Cream, and both of those are usually fairly expensive also. Our Estriol Vaginal Cream is $69 for a 3 to 5 month supply, depending on if you use it twice a week or 3 times a week in the end. Whereas the commercially available products like Premarin and estradiol or estrase vaginal cream can be upwards of $300 a month. Even if they're covered in your insurance, many times they are a $100 copay. We hear it all the time. That's one of the reasons gynecologists and urologists send us prescriptions for Estriol Vaginal Cream all over the Pacific Northwest. So what does Estrogen Vaginal Cream help prevent? It will help with atrophic vaginitis. What is that? That's a fancy word for vaginal dryness. Estrogens help to stimulate collagen production in the vaginal tissue as well as other areas in the skin, and it helps to keep that tissue plump, moist, and stop from atrophying. That's the first and foremost, and that's usually why they're prescribed primarily is for the atrophic vaginitis, which usually happens earlier in menopause. So maybe in your 40s, maybe in your 50s when you reach menopause, you might start having some of those symptoms. Here's the beauty of Estrogen Vaginal Cream. Not only is it good to prevent that problem, which also, that problem can also cause painful intercourse. Because of the vaginal dryness, intercourse will be painful. So you fix that problem and intercourse isn't painful anymore. But it also works for some other things also. So Estrogen Vaginal Cream will help to prevent urinary tract infections. Estrogens prevent the bacteria from growing in the urinary tract. It's a proven fact over and over again. Many times you don't need a medication like antibiotics, chronic antibiotics, to prevent that bacteria. What caused the bacteria to grow in the first place? Usually it doesn't happen to women when they're in their 30s before menopause. It happens after menopause that they get chronic urinary tract infections. Why is that? Lack of estrogen. You don't need antibiotics because you don't get infections anymore. Also, another thing, urinary incontinence. So problems with bladder incontinence, which is very common as women age. Why is that? It's from lack of estrogen. Estrogens help to increase bladder tone. And when you increase bladder tone, you don't have that urinary incontinence. So you might not need a medication to prevent that urinary incontinence that can cause all kinds of side effects. Here's how you use the vaginal cream. It's very easy. It'll come in a bag like this. An applicator is included with each bag, each prescription. We do that because some patients do use the applicators. I will tell you that what I recommend and most urologists and most gynecologists recommend, do not use the applicator. The applicator can get contaminated and it can also irritate sensitive tissues. So you can apply it with your finger to the inner and outer labia and it works just fine. The applicator is nice to find out how to measure the 1 gram. A normal prescription, a usual prescription is usually 1 gram. It will come sealed like this, and then you screw this on, and usually 1 gram is the dose. So pull this down to 1 gram, and you squirt that much cream into the applicator. You squirt that applicator out, put it on your finger, and apply it to the inner and outer labia with your finger. Now, I will tell you, after you've done it a few times and you know what one gram looks like, you really don't have to use the applicator. You can just put it on your finger and kind of guess how much it is, and it works just fine that way. So another common question that I get is, how long do I have to use the Estriol Vaginal Cream? Well, you're not going to magically start producing your own estrogen again. So you'll use the Estriol Vaginal Cream for the rest of your life. We have women in their late 80s that are still using the Estriol Vaginal Cream. Usually you use 1 gram at night for 7 to 14 days, and your symptoms should start clearing up after that. The vaginal dryness symptoms should. Then after that, you only have to use it 2 to 3 times a week. Some women can get away with using it 1 time a week. Now, with urinary tract infections and urinary incontinence, it can take a few weeks to a few months before you will prevent that problem. And Estriol Vaginal Cream does not treat urinary tract infections. It will only help to prevent them. So many times you have to treat them first and get rid of the bacteria and use the cream to prevent other ones from coming back. So if you have any questions, Moses Lake Professional Pharmacy, give us a call. As always, our pharmacist will answer your questions. 509-764-2314. Thank you for watching.